Welcome back to Live Healthy Now. I'm Beverly Miller, registered dietitian and your host. Remember, if you've got a question for us, give us a shout at 416-446-7090 or tweet us at VegBev. Still to come, Dr. Edward Gelfand of Dawson Dental Centers talks dental implants. But first, going to the poll that we had up on our website this past week about dental implants, we asked you two questions. The first was, would you consider getting dental implants? Well, 60% of you said yes, 20% of you said no, 20% said, I'm unsure, I need more information. And then our second question was, who would you prefer to do your implant procedure? Well, 40% of you said, unsure again, need more information. 20% said a cosmetic surgeon, 20% said an oral surgeon, and that's what you guys were telling us this week, which brings us right to our next guest, Dr. Edward Gelfand, dentist, owner and founder of Dawson Dental Centers, and he's going to be talking to us about implants. Hey.
Hello.
Hello. How are you doing?
Great. It's nice to be here.
It's nice to have you on. You know, our smile is perhaps what our best feature, and if we're unsure about what we look like when we smile, that really impacts our self-esteem, our confidence, and that's where you come in.
Absolutely. That's exactly where I come in, to help out cosmetic work and implants. And you know, implants are probably one of the best things that happened to dentistry in creating the beautiful smile that people are looking for.
So let's just dive right in. What about implants? What are these implants? How are they different from dentures? Talk to us about dental implants.
Well, first of all, when somebody's losing a tooth, losing teeth, what naturally happens is the bones start shrinking and the teeth start shifting. And it becomes more and more difficult to restore it with something that's comfortable.
Okay.
So ideally, dental implants will be placed right at the very beginning, after the teeth come out. The sooner the better. After a period of at least 4 to 5 months, once the tooth is out.
Okay.
In order to preserve the bone.
All right.
Okay. Yeah.
Go ahead. I was just thinking, we have a video. We could show that video, and you can tell us what we're seeing on the monitor.
For sure.
Yeah. Okay. So let's go to that video then. Okay. So what are we seeing?
So right here, a tooth is being extracted, and once the tooth is out, the adjacent teeth start shifting into the gap, and the opposing tooth is coming out of its place. Okay. At that point, it's very difficult, almost impossible to actually place a tooth in there.
Oh, I didn't realize that the other teeth would shift. I thought it's a static thing. No.
So once one tooth is out, it actually affects the bite. It affects many other teeth in that region.
Right.
And that's the reason it's important to replace a tooth or teeth in general.
Okay.
But why implants as opposed to anything else? Well, an implant is the closest thing to a natural tooth.
Okay.
It's fixed into the gums, into the jawbone, very easily.
Now, when you say fixed, it's screwed in, isn't it?
You can say it's screwed in.
Okay.
Very gently.
Painful.
It's actually not.
Okay.
It's actually not. You know what? Most people that get implants placed nowadays, well, at least in our offices, say that it's actually easier than having a tooth pulled.
Very nice. Okay, that's good to know.
So it's a nice comparison if somebody ever had a tooth taken out, comparing to placing an implant, it's usually an easier procedure.
Okay. All right. We do have a video of the post being put in. Let's take a look at that then, and you can kind of walk us. Oh, yes, see that? Yeah.
And it's simply threaded into the gums, into the bone.
Oh.
And within 3 to 4 months, the bone grows right around the implant, and then the implant is ready to have a post and a crown that will fit over it.
Wow. And then that just stays forever?
and then it stays put just like a natural tooth.
Okay.
It
well,
feels
natural
and acts.
teeth will fall out over time sometimes. Can these fall out, or they're...
Not very likely. They're more
Okay.
likely to stay in your mouth than your natural teeth.
All right.
Yeah.
Okay, so those are implants. You've got a lovely selection of teeth here. What are these?
Yes. Okay. So there are a few examples of what implants are like
Okay.
in a plastic model.
All right.
There's a few examples here. I'm going to let you
Okay,
hold on
I'll
to it.
hold this. And what are we seeing?
So these are all individual implants, or a titanium implant is placed into the gums when a person is missing one individual tooth, and a post is placed afterwards over the implant, and a crown that looks like a natural tooth is placed right over it.
Okay.
Okay. This whole process traditionally will take 4 to 6 months.
Wow.
Okay. Now, there's and this is a replacement of one individual tooth.
Okay.
Okay. Very often people have more than one tooth missing. Sometimes they're the entire arch of teeth missing.
Okay.
Okay. And in those cases, traditionally, what we would do is place 2 or 4 or more implants, and a denture, their own denture, would be anchored to those implants.
Okay.
Okay. But once it's anchored, it stays put, and it doesn't come out that easily.
Okay, so they're not taking it out every night and putting it in the bedside thing.
They're still taking it out.
Oh, okay. All right.
It's just more stable than a conventional denture.
Right. Okay. Wonderful. So I'm sorry. What about this one then? Is this an?
This is a more advanced procedure.
Oh.
It's called all-in-4. Okay,
Is that the teeth in a day thing?
That's the teeth in a day.
Yeah, another service that you have. Tell us about this. This is teeth in one day. It sounds intriguing.
This is really exciting.
Okay.
Traditionally, if a person had to have the teeth out, somebody comes in with really bad teeth, and most of them or all of them have to come out. They would have to walk around with a denture for about 6 months at least. Very often have bone grafting, because once the teeth are in bad condition, the bone usually gets resorbed to a point where there's not enough of it to actually have implants placed.
Okay.
Very often they need bone grafting, the addition of bone augmentation, and then wait another 6 months. We'll place implants, and then we'll wait another 6 months until we can actually put the teeth on top. So traditionally the process will take between a year to a year and a half.
Wow.
Once the teeth come out, I know it sounds scary. I know,
Is it showing on my face?
it's showing your face. But yes, and they have to walk around with a denture that's very often doesn't fit very well. Sometimes it fits, but it creates sores.
Okay.
And until they can actually have something fixed that they actually enjoy. With this new concept, all-in-4, or teeth in a day, we're actually able to take the teeth out and place 4 implants in a very strategic position,
All right.
in such a way that teeth can be placed right away the same day, and the person can walk out of the office and function with those teeth.
Fantastic. So whereas it was a year and a half before,
Between a
now
year
it's
to a year.
1 day?
Yes,
That's
the
crazy.
same
That's
day.
crazy good. Wow.
The same day. So that's the most exciting part of this service
Yeah.
to our patients. When they come in, they want to leave with teeth, but they will also want to leave with teeth that they can function with, teeth that are going to stay put and don't come out. So they get a bridge that's secured by 4 implants, and it just functions like their own teeth. 6 months later, some areas of the gums shrink, and we will give them a new bridge, a more permanent one.
Okay. Wow. How does nutrition factor into all of this? What should we be doing nutritionally to make sure we keep our teeth healthy?
Well, calcium is very important, but one of the most important things is just brushing, flossing, and coming to see your hygienist on a regular basis. And that helps maintain the gums and the teeth in in great shape. Also, cavities, like everybody knows, are formed by sugar, right? So just cut down on sugar snacks.
Right.
And pop, Coke, acidic juices.
Right.
Right?
Can we eat too much fruit? Can that be detrimental at all?
No, eating fruit is great.
Okay.
But drinking a lot of cranberry juice, drinking a lot of orange juice will actually increase the likelihood of getting cavities. And
okay. Is it a good idea then, if you're drinking a lot of juice or after you drink juice, to chase that down with some water? Would that get rid of the stuff that's sitting on the enamel?
Yes, absolutely. That's a great idea. And also mixing juice with water, diluting juice is great. One interesting point is that if you don't have, if you can't rinse your mouth and just ate or had some sugar snacks, get sugarless gum. Okay. Sugarless gum is actually great.
Okay.
To increase salivary flow and it helps decrease the sugars in on the teeth.
Okay. Fantastic. Well, what other services do you guys offer? On the website, I was reading these big, gigantuan words. What was it?
Neuromuscular dentistry.
Yeah. I was like, what is that? Neuromuscular, whatever, muscular?
Neuromuscular dentistry is a field of dentistry that I practice and a few of our dentists practice as well at Dawson. Okay. We do a lot of the dental work in a way that is consistent with how the muscles on our face want the teeth to function. Very often dentists or orthodontists will move teeth or create a new bite that is not very comfortable for the facial muscles.
Okay.
And as a result, people start grinding the teeth. And some people attribute this to stress. But in most cases, it's actually the discrepancy between where the muscles want the teeth to be, where the muscles want the jaws to be, and where the teeth want the jaws to be, and how the jaws will come together if it was up to the teeth.
So right? Interesting. Okay.
So because the teeth come together like a puzzle.
Okay.
Right? If you close your back teeth, they're going to come together like a puzzle. Right? The muscles may not want the jaws and the teeth to be in that same position. So if there's a conflict over there, they're going to be fighting forever.
Wow.
Okay, and that fighting is that grinding of the teeth.
Yeah. And over time, that wears down the teeth itself.
Wears down the teeth. People get sore jaws. Very often they get migraines. They get joint issues, and all that can be prevented. It can be fixed in many cases. But it's even easier if it's prevented, if it's thought through right from the beginning, when we move teeth orthodontically or fix teeth with crowns, bridges, with implants. So a lot of the work that we do is based on neuromuscular dentistry.
Right, interesting. Now, I've heard it said that the health of your mouth, your teeth, affects your overall health.
For sure, definitely. And it's becoming more and more known, and more people are aware of the importance of gum health and how it affects your whole body. Periodontal disease, gum disease, affects the likelihood of stroke and heart disease, diabetes, and even low weight births.
Interesting. In children?
In children, yes.
I didn't know that part. Very interesting. Now, just as an aside, you've worked on some really interesting, famous people. I was looking on the website, celebrities and Miss Canada pageants and all the rest of it. So you've done some really, you've probably got some very interesting stories there.
Yes, well, I'm blessed with people searching for me and looking to come to get beautiful smiles. And some like to stay discreet, and some don't.
Absolutely, yeah.
But yeah, there's been quite a few celebrities that came to be treated and to get nice makeovers, and smile makeovers. And nowadays we can even get it done in 2 days.
Wow.
It's pretty amazing.
That is amazing. That is amazing. And so we've got about a minute left. Can you tell us a little bit more? What could we expect, if we came to see you? kind of thing. You've got various locations throughout the GTA.
Yes, we have 13 locations.
13 locations.
13 Dawson dental locations, all high-end. And when you come to see me, we have our first appointment, first consultation about you. We try to find out about you as a person, about your desires, about what you'd like to do. And everything that we do from this point on is based on your needs, your wants, and your financial abilities as well. And we help you create the best possible health and beauty that we can achieve at this day and age.
Fantastic. So it's all about that wonderful smile.
Yes.
Taking the smile that you have, that the person has, and just enhancing it.
And getting there in the fastest and in the most comfortable way. And there's some really amazing ways to get there nowadays.
Right. Fantastic. So before you go, tell us again your top 3 things for good dental health. What should we be doing at home?
Flossing, avoiding sugar snacks, and coming to see our hygienist.
How often do we need to see our...
Well, everybody's different. Some people need to see them every 3 months, some every 9 months, and a lot of people every 6 months. But when you come to our offices, the plan is always individualized. The care is individualized, and we assess your needs based on what's happening in your mouth.
Fantastic. Dr. Gelfand, thank you so much for being here with us. When we come back, actually, just before we go, dawsondental.ca is your website, and your phone number? It's 1-877-943-2976.
Thank you.
And okay, when we come back, we'll be talking with Andrea Barrett, culinary nutritionist. She's going to be creating a delicious truffle with sweet potatoes. Go figure. Looking forward to that. Give us a call if you got a question, or send us a tweet or email us. But stay put, because we will be right by.